By doing the best for our children, we can change the world. And that is very much the basis on which the Alliance for Childhood works. A building of trust. That's the foundation that we have between ourselves, that we all want the best for our children, and that brings us together and unites us in a common purpose. And in that way, we can see past the boundaries of age, we can see past the boundaries of nationality, belief, whatever. We can see beyond that. And but also developing an intergenerational empathy. We can understand each other regardless of our age. That's an important part of building this foundation, of this vision that we still have. And today, I think it's very important. This is the first time we've included the young people of today in our debate in the Parliament. We've talked about them a lot, but now we're going to hear their voices today. And that's part of building up this trust between us, which, as she says, is the foundation of a better world. So I hope that you enjoy this morning and find it inspirational. Madame Maxwell.
Thank you very much for the floor. Ladies and gentlemen, thank you very much to be here with you and share your experience and experiences with this topic. It's a pleasure to host this event because mental health is a very important topic of my professional political career, and I am glad to support this topic. The quality of environments in which children live is fundamental to their mental and physical well-being. It is our moral obligation to ensure that our children grow up in safe, supportive, and inclusive surroundings. Today, we find ourselves in an area where children have access to both online and online worlds. This space offers unique opportunities and also challenges. The digital area presents new dimensions, from physical attributes to social norms. However, let us remember that the online world is an extension of the offline world. The offline world's conditions, from accessibility to economic circumstances, influence the quality of child's online experience. Ladies and gentlemen, our presence here today reflects our commitment to protecting the mental and physical health of our youth. The burden of mental health problem on our children is a pressing issue that we cannot ignore. Let us seize this moment to explore and understand the interplay between these environments and their impact on our children's well-being. It is our responsibility to create safe, supportive spaces, both in our schools, homes, and online space. We must work together to bridge the gaps in accessibility and affordability. I believe that European institutions have tools to make decisions to support the mental health of all children and youth. We just have to use them. And together we can achieve the necessary changes. My speech was really brief because I am looking forward to hear our experts, great experts, and also our young students, people, and their experience. Thank you very much.
Thank you, Madam Maxova. So now we pass it to Dominic, who's going to introduce our new policy paper on mental health. Thank you, Dominic.
Thanks, Christopher, and thanks everybody for coming along to listen to what we have to say today. This policy paper was drafted with Gianluca Monali and with the support of Barbara Schiller, Francesco Zoccarato, Olivia Pierford, and Russell Hearn, and thanks to Christopher and Gianni for adding their touches to it. I'm not going to speak too long, because I think I'm going to touch on issues that people understand already. And we'll try and get through to the issues of policy quite quickly, because it's not, our paper is not the first. Please move to the next slide. Our paper is not the first to highlight the challenges of child and youth mental health in Europe, nor what this means for children's rights and their own achievement of their well-being. We know that poor mental health spills over into physical health and education, children's future opportunities in the labour market. And unfortunately, we do know that in Europe, there is a particularly high prevalence compared to other areas of the world for children experiencing anxiety and disorders. And other mental health disorders. Now, that might be debated as to whether it's because Europe is better at identifying and measuring those disorders. It might be that we're dealing with something that I think HBSC once coined as affluenza. There may be other things going on, but the numbers are the numbers for Europe, and we should pay attention to those. If you click again, please. What our paper says, if we were to put it in a nutshell, is that it's the environments that matter, that safe conditions are crucial to children's mental health, and not just to preventing poor mental health or indeed treating conditions of mental ill health, but promoting the best possible mental health that children can have. And really, that's what we should be aspiring to. But we're dealing with this demand for safer conditions, more stimulating conditions for children and youth at a time where we had not fully recovered in Europe from the global financial crisis, and another economic crisis comes along in the form of the cost of living crisis. COVID-19 had its own unique effects on children suffering disproportionately in terms of their mental health. The climate emergency, I have to say, is less of a problem for older people like me than it is for younger people, and we should be attuned to that. And all of these things increasing insecurity and stability. And it's insecurity and instability which brings your future close to your face. And it creates challenges for your mental health and well-being. Next slide, please. So we have some recommendations for the Alliance for Childhood, which is to address child and youth mental health through trauma-informed steps, to address the needs of children from day one, to be honest and open about the discussion of mental health. It happens. It shouldn't be stigmatized. And in respect of understanding that all environments matter, you have to take an integrated policy approach. There's no point in expecting schools to do all of the heavy lifting, primarily because children under 6 often don't get into schools. And so we're missing the very earliest cases if that was the case. Everybody needs to be involved. It requires a comprehensive approach. We need to support data collectors, and we have more than a couple of data collectors in the room who are doing their very best to tell us what's going on with children. And frankly, it's a priority that we have that information. We need more, better information more often. What we have is quite exceptional already, but we need really to do more, particularly picking up on what's going on for the youngest children and our regularity of reporting. And we could introduce within educational policies ways to promote positive mental health. So let's click on the next slide. The main point I think that's important in this slide is noting the cost. This estimate comes from State of the World's Children, UNICEF's report, that estimates the cost of child and youth poor mental health in Europe ran to 57.6 billion euros a year. 57 billion euros is an awful lot of money. If you lived in the UK, it would pay for the child allowance for approximately 9 years. It's serious money when it comes to policy. And when you have serious costs and serious losses, we need to consider buying ahead the interventions needed, not only to address the moral and ethical issues, which is children's poorer well-being and mental health, but also to do something that's good for the nature of how societies work and make savings and reduce costs. The other points I think I've reflected on already. Perhaps what I want to say here, actually, I didn't say, is that European governments are probably the most equipped to manage this problem. Not only are they committed to it, they're all signatories and ratifiers of the UNCRC, signatories to the SDGs, concentrating on social, economic, and human development, and have more social policies at their fingertips than anywhere else in the world. Next slide, please. So what do we know? Well, we know that nearly 9 million children, adolescents suffered from mental health disorders in 2009. We know that was before the COVID crisis, so we expect that to go up. OECD said it would be higher, that there are gender differences, that girls will suffer more with anxiety and depression. But it doesn't just affect adolescents. There are estimates of anxiety and depression in disorders, approximately 1.5, so let's say 3 in 2,000 European children before the age of 4. And in adolescents, in between 5 and 9, up to 20 children in 1,000. If we click again, please. And as we look at how the mental health problems develop by age, the biggest jump is between the prevalence between 5 to 9 and 10 to 14. My children are changing schools often. They're moving from primary to secondary school. There's issues related to puberty and personal development, which will be happening at that stage. And next slide, please. So here's some of those numbers. You see anxiety and depression disorders are higher, and you can see the girls' rates are significantly higher than the boys', though boys are experiencing more attention deficit disorder, hyperactivity disorder, and conduct disorder. Click again, please. And here's the overall prevalence rates that I mentioned before. We're looking at, for girls, approximately 19%, and for boys, 16% in their older adolescence. We click again, please. And this is something that Joe will recognize because it's from your survey. Thank you for doing that good work, Joe. This is the percentage of children with problematic social media use, which means obsessive use, addictive use, lying about the use, affecting relationships with families and friends in order to access and use social media. And you can see that in some countries it's up above 6, 1 in 6 children. And in some countries such as Italy, it's younger children that seem to have a higher problem than more of a problem. So next slide, please. Okay. So we know that the online risks are also impacting children's safe space, and it's a concern. And excessive use of digital media can affect children's anxiety and stress. I know there's experts in the room. I shouldn't linger on this topic for fear of not saying it exactly how it should be said. And we've looked at those rates. Can we have the next slide, please? So that we've talked about the stresses with COVID. We know that this is an economic crisis and the instability. We talk about this in our paper and try and highlight where we think the pathways to increased mental health stresses would be. But we shouldn't forget that these are not unique, mutually exclusive things. They're happening in conjunction. And I don't think we have enough evidence on what the compounding effect is. Can we go to the next slide? This, I didn't focus on the online world so much, but I know that Sonia's coming up and we'll just move on if there's questions about that. Okay, so there was 4 policies that are coming out that are based upon the Commission's statement in June. And the first one is Child and Youth Mental Health Network. I mean, we support all of these policies, but we think that the first one could work more on data and research methods, particularly on prevention. The second, the prevention toolkit, talks about supporting bullying in schools and other things, but it doesn't talk about domestic violence. It doesn't talk about bullying outside of schools. And there's no reason why that shouldn't be added. The Youth First flagship, which is focusing on one of its 5 elements on well-being and health, has a total budget of 2 million euros. Remember how much the cost is, 57 billion. And then with Healthy Screens, Healthy Use, there isn't reference to problematic social media, despite the fact it's building off the Better Kids online. It's still missing. So there's a lot of goodwill, but not everything is covered. And Europe can do it. So that's what we're asking for. Can we have the next slide, please? And I'll finish talking, so I promise to be quick. We'll just go back one. Just to say that as the Alliance for Childhood have adopted a new model for understanding effects on children, and it very much speaks to the whole child well-being, and it speaks to the role of environments in producing that. What we're asking for is very much in line with the principles of the Alliance for Childhood, and it's very much within the realms and the abilities and the resources of the European Commission. Thank you.
Thank you very much, Dominic. We'll get a chance to ask questions when we've heard the next 3 speakers, and then we'll come back if you've got any points, if you hold it in mind. So, Professor Joanna Ingley from Scotland.
Thank you, Christopher, and thank you, Dom, for the invitation. It's really great to be here. So I'm Jo Inchley, I'm based at Glasgow University, and I'm also International Coordinator of the Health, Behaviour and School-Aged Children Study, which I'll be presenting some data from today. And I want to talk about mental health, particularly in the context of schools. That's my brief. So I'm going to split the talk into 2 bits. Firstly, presenting some recent data from HBSC study, where young people tell us a little bit more about their mental health and well-being, but also their experience of school. And then I'm going to think more in detail around the school setting, what the challenge is, what might be some of the ways forward. So for those who don't know much about, next slide, please, the Health, Behaviour and School-Aged Children Study, just a brief bit of background. So we collect self-report data from 11, 13, 15-year-olds in the school setting every 4 years. It's been going since the mid-1980s. We're celebrating 40 years this year. So some of our data goes back over 3 or 4 decades, allowing us to really track how young people's health has changed over that time. So we look at different aspects of health behaviour, risk behaviour, and also look at health in its social context. So some of those key settings, including schools, families, and peers. The latest survey took place in 21-22, over 220,000 young people from 44 countries. So we haven't yet launched the new data. So some of the data I'm presenting today will be from 2018, but I've also got some headline figures from 2022, which I'm able to share with you in advance of our launch in a couple of weeks' time. So first of all, looking at life, next slide, please. First of all, looking at life satisfaction, which is an evaluation of one's life as a whole, and young people are asked about their life on a scale from 0, the worst possible life, to 10, the best possible life, and this represents mean life satisfaction scores. So apologies for the graphs, you can't see the detail. This is 45 countries, aged 11, 13, 15. But what you can see, I think, is that generally young people report relatively high satisfaction with their lives. There's very few gender differences, particularly at age 11. As they go through adolescence, we do see more of a gender difference emerging, with boys reporting higher life satisfaction than girls. If you can see the actual numbers in grey, those are 2018 figures, and in blue, they're 2022 figures. So what we can see is that we have seen a decline in life satisfaction in the last 4 years, which is interesting because up until that point, trends were relatively stable over time. And you can also see the age-related declines for boys and girls, which are stronger for the girls. So moving on, next slide, please. We have another indicator of mental health and well-being. We call it the multiple health complaints measure. Can we bring up the next slide? Thank you. So this is a composite measure which includes both somatic and psychological symptoms. So psychological symptoms include feeling low, feeling nervous, feeling irritable, and having difficulties getting to sleep. And the somatic symptoms are things like headache, stomachache, backache, and dizziness. So this chart shows the proportion of young people who report 2 or more health complaints more than once a week. And here you can see from the charts at a distance, a bit more cross-country variation and bigger gender differences. So at age 11, girls are already reporting more multiple health complaints than boys, but by age 15, those gender differences have really increased. And this measure, we have seen big declines, and particularly in the last 4 years. So that, yeah, you can see the grey numbers compared with the blue numbers. So now, well, in 2018, for example, around half of 15-year-old girls reported multiple health complaints. That's gone up to 66%. So 2/3 of 15-year-old girls now reporting multiple health complaints every week. And you can also see the difference between boys and girls in terms of age-related declines. So for girls in 2022, there's a 24% difference between 11-year-olds and 15-year-olds, whereas for boys, just a 5% difference. So that's a 5-fold difference between the two genders in terms of how age impacts on development, impacts on multiple health complaints over those critical developmental years. So looking at trends over time, this goes back 20 years from 2002 to 2022, multiple health complaints. The girls are in red, orange and yellow, and the boys are in the green and blue colours, different age groups. So this is just to really point out that up until in the early 2000s, again, there was relative stability. Around 2010, we started seeing an increase in multiple health complaints. And then over the last 4 years, that's really changed. And we've seen a much more marked increase in those reporting these symptoms on a regular basis. When we break that down to the, oh, sorry, I'm jumping ahead on my computer, not yours. Can we have the next slide, please? Okay, so here's the trends. And if you could just click the button again, I think there's a couple of arrows to come up perhaps, and another one. Yes, apologies for that. Yes, so here you can see from the early 2000s, relative stability. Around 2010, we start to see an increase, particularly amongst the girls. And then from 2018, you can see a much more steep increase in multiple health complaints, again, particularly amongst our older girls, 13 and 15-year-olds. So next slide, please. Yeah, so here we break that down into the individual symptoms, and we've got the somatic symptoms on the left and psychological symptoms on the right. So what you can see here is that the weight of the burden is around the psychological symptoms rather than somatic symptoms. And it's much higher amongst the girls in green than it is amongst the boys in blue. In 2018, about 1 in 4 adolescents reported feeling nervous, feeling irritable, having difficulties getting to sleep every week. That's gone up over time. And now you can see that over half of our 15-year-olds are reporting feeling irritable, feeling nervous every week. And substantial numbers also feeling low and reporting sleep difficulties on a regular basis. Next slide, please. So we also included a measure of loneliness this time in the survey, and we've got some quite sobering data here. Typically loneliness associated with the older generation, but actually it's a real issue amongst our adolescents as well. So you can see again, age-related increases in loneliness. By age 15, over 1 in 10 boys report feeling lonely all or most of the time, but over a quarter of our girls say they feel lonely most or all of the time. I'm just going to stop for a minute. Next slide, please. To note that these patterns of mental health and ill health are not equally distributed in the population, and I think that's really important to remember that. So adolescents from less affluent families are reporting lower life satisfaction, they're reporting poorer self-rated health, they have more frequent health complaints and higher levels of loneliness. Many of these patterns of inequalities are embedded from birth. So poverty is a really important area to address if we're going to improve outcomes for many of our young people, as Dom's already alluded to. Next slide, please. So that's what the data is telling us. That's what young people are telling us. What about schools and mental well-being? So there's a lot of evidence now to show how important schools are in promoting the mental health and well-being of young people and protecting against the risk. So for example, better mental health is associated with feeling a sense of belonging at school, feeling connected and safe at school, having an inclusive school climate which celebrates diversity, and having strong supportive relationships between children and their teachers. On the other hand, we know that poorer mental health is associated with higher levels of exam pressure, greater focus on academic performance, low perceived academic performance, and where there's high levels of student aggression and bullying, for example. So that's great. Next slide is trends in liking school. So this shows, gives an indicator of school satisfaction over time, again, looking back over 20 years. So you can see there was actually a slight increase over time in the early 2000s, but in the last couple of survey rounds since 2014, again, we've started to see that decline, particularly for our 13-year-old girls in the last 4 years. Obviously, for the 11-year-olds, they tend to like school more. For many of our 11-year-olds, they're still in primary school, not in all countries, but that might explain some of the differences. Right, I'm short of time, so I'm going to have to crack on. The next slide, please, looks at school pressure. And again, just to draw your attention to the last 4 years where we've seen this really steep increase, particularly amongst girls and older girls, in the amount of school pressure they're experiencing. Next slide, please. And we see that from other studies too. So the Good Childhood Report in the UK is just published, and you can see at the bottom there that school is one of the domains that children say they're least happy with across different areas of their life, and most likely to score below the midpoint on this scale in terms of happiness. Next slide. So I'm going to quickly go through some of the challenges that we're facing. Next slide, please. Around the school environment. So the first thing to say is that the education system can be inflexible. One size does not fit all. You'll recognise this image of us trying to fit a square peg in a round hole. Now, quite a lot of children are round pegs and fit quite nicely into the school system, but we have a lot of children who are square pegs and lots of other different shapes as well, and they do not fit into the school system, and the school system does not always accommodate their needs. Next slide, please. School attendance is an increasing issue in many countries. We've had lots of debates around this in the UK, lots of children not attending school for various reasons. It's got worse post-pandemic. It reflects increasing disengagement with the school system, again, probably linked to the system not quite meeting the needs of all our children. But we need to stop focusing on getting children into school and start understanding what the reasons are why children are not able to attend school in the first place. Next slide, please. So we've talked about toxicity already. So here's a recent headline for an online article about achievement culture, creating this toxic environment, which is hugely detrimental to young people's health and well-being. And there's been a recent editorial in the Lancet Child and Adolescent Health around taking academic pressure seriously. When there's too much pressure, academic pressure on young people, it places priority on compliance and performance and takes away from young people's creativity and autonomy. Next slide, please. And that's not just functioning at an individual level. We also see this functioning at a country level, national level. And the educational stresses hypothesis really states that contemporary societies, by putting more emphasis on education, as evidenced by the shift towards knowledge economies, are actually increasing the stress on young people as they feel that their life chances are dependent on their educational performance. And that is in turn impacting on their mental health. Next slide, please. And finally, what we're seeing is that school staff are on the front line of the mental health crisis today, and they're not well equipped to deal with that. So schools are overstretched, teachers are taking on this responsibility for pastoral care, they feel overwhelmed, and children are falling through the system. Next slide, please. So there's a number of different ways that we can address this. I won't linger on this slide, but there's various ways that schools can create more supportive environments for young people's mental health and well-being. We can pick up on some of these later if that's of interest. But I want to just finish by focusing on, next slide, please, these 4 key basic needs that I think we need to have in place if children are to flourish, if we're really going to be able to see changes in young people's mental health and well-being. So these have been identified as fundamental psychological needs that children have for connection, for meaningful relationships with other people and the ability to communicate and have that emotional support in their lives, for competence to develop and build the skills they need to grow and be successful, for agency and autonomy, having the ability to take control of their own lives, to make decisions and contribute effectively to society. And fourthly, for safety, and I don't just mean physical safety, I mean emotional safety, so that children are living in spaces and places that are free from threat. And schools are still places where young people encounter bullying, harassment, shame and humiliation, and we need to change the system around young people to promote these 4 basic fundamental needs if we're going to allow our young people to grow and flourish. So I'll leave you with that thought. Thank you very much.
Thank you very much, Chair. Thank you. A lot to take in there. And just to say that if you find it's all too much today, this will all be on YouTube in a week or so, if you want to recap what you've heard. Thank you very much. So, Professor Sonia Livingston from the LSE, please.
Thank you very much for including me, and I'm going to come to questions of well-being in relation to the online environment. I think my slides are just loading. Yes, okay. I'm a social psychologist, and I'm talking on the basis of several European Commission funded research projects that I've been involved with in relation to children and the digital environment over the last few years. And I'm going to make my brief remarks with a child rights framework, knowing that Europe has mainstreamed children's rights. So if I can start with some research just released actually from the Y-Skills project, which is a research project looking to see how building digital skills as part of the skills agenda can help young people navigate the digital environment. And this new report is child-led or youth-led research findings, in which, having interviewed young people with mental health difficulties, so specifically vulnerable and at-risk group, we asked them to work with us on how to present the findings and on how to, as it were, tell the world what was important to them about their digital lives and how they're learning to manage it given their problems. So they came up with 8 findings, which we've just released here in a number of languages already. Perhaps what I'll pull out, they recognised, as do researchers, that mental health problems have many causes, but they certainly see social media as part of the problem. And they see it as part of the problem in a whole range of ways, which is part of why it's so difficult to manage. So that includes exposure to some very extreme content. And I heard about more extreme content from this group than I do with as it were, a typical, a normal average population, but also they find difficulties with normalized content. And I think the case of unrealistic body images is a really interesting one when we try to think about policy recommendations. And they were also very aware of how they all have their individual triggers because of their particular challenges and their particular experiences of mental health. And that's also, I think, very difficult for policymakers to address. They were very clear, however, that they would not give up their phone. I think actually I would not give up my phone either. And I think, and they articulated this as recognizing the importance of the online world as a source of support, as a support of help, a source of help, a source of belonging. Actually, the 4 areas that Joe just outlined, I think we could really fit there. What we heard from them in relation to skills, and I know many people say, well, look, young people know best, or they wise up most rapidly, or they can, understand better than adults. We had a lot of effort trying to understand algorithms, trying to understand data, trying to understand privacy or visibility or how to work the settings. But that doesn't mean that they feel that they can manage it all. So their skills, they're putting a lot of effort into the skills, but the skills are not enough because these are incredibly fast changing environments and very technically complicated. And in fact, I think all of us would struggle to articulate exactly how the visibility or privacy or extreme content sharing side of the internet works. What came over very strongly is a sense of being left to themselves, left on their own. Society is not supporting them sufficiently as they see it, and by society they mean school, parents, industry, government, and clinicians. So they, on all sides, they felt they needed more. In the Y-Skills survey, we did a survey across a number of European countries over 3 years, and we could see there that the young people who are more vulnerable in their offline lives are also experiencing more risk and vulnerability online. So there is a compounding finding and compound risk between online and offline. And indeed, of course, no part of children and young people's lives these days are untouched by the digital. So the risks and the problems multiply and compound. So next slide, please. So in the EU Kids Online survey, which in a way is a sort of parallel to the survey that Joe talked about, we really focus on young people's experiences in the online environment, thinking about their access, their skills, their opportunities, risks, and safety. We have a lot of statistics in the 2020 report, which I would love you to read, but we only got funding to repeat this after 10 years. So with a 10-year gap, I can tell you that we have double the number of children over 10 years who say that the online environment has upset them recently in ways that are a concern. And when we dig into what kinds of upset, it's all the 4 C's of online risk. It's to do with the content, the contacts that they come into, it's the ways in which people conduct themselves online, and it's the contract risks, which we've been increasingly researching. Who's getting their data? What kind of scams? What kind of phishing? What kind of risks to do with the platforms themselves? The biggest increase, or the most common risk that we heard about in the survey was hate, and the biggest increase was an exposure to self-harm content. We also used the survey to explore what some of the solutions might be, and we tried to kind of examine some of the solutions that especially the Better Internet for Kids Plus program is promoting as part of the European Commission. So there we find, for example, there's been a lot of work on privacy settings, but actually when something goes wrong, only 14% of adolescents said that they changed their privacy settings. There's been a lot of effort to try to get make it possible for young people to report the problem to the platform so that the platform would do something about it. But in fact, only 12% do. And qualitative work tells us that's because they don't believe the platforms are trustworthy or responsive or accountable for what they do with their data. So the platforms really must do better. Next slide, please. So I said a child rights framework because I've been giving a lot of thought to what it is that countries can do, and many countries are trying debating many kinds of ways of regulating platforms, and Europe, of course, very crucially, has now passed the Digital Services Act, which is really a global leap forward in this regard. The UN Committee on the Rights of the Child recently produced its General Comment 25, which kind of goes through the whole range of children's rights in a holistic way to try to make a whole series of very practical recommendations and measures that are available to states and other duty bearers, including businesses, including platforms. And it emphasizes the importance of a holistic approach. In other words, not protection, yes, but not protection simply at the cost of children's civil rights and freedoms. But there's a lot of effort to try to find ways to address protection and participation and indeed privacy. It's important in a child rights framework that the provision is age appropriate, that it recognizes children's evolving capacities, which is very difficult when we don't know how old a child is online or when a platform doesn't necessarily know. It's really critical that the technology mediate or technology facilitated solutions, I'll put in scare quotes, are differentiated because there's as much diversity and variation among children as there is, of course, in the adult population. And it's really critical that business is accountable for the kinds of strategies. Next slide. So I just wanted to put up some of the quotes from young people in the consultation that went into General Comment 25. These are, of course, anything the UN does is global. So these are quotes from children around the world, just to bring to life not only the concerns they have, but sometimes the kind of nuance and thought with which they express the nature of the problem and also point to the kinds of solutions. And I think what we see when we do deliberate with children and young people, which I suggest is really vital in this field, we hear how much they want answers which are properly resourced, effective, balanced, fair, and informed by their experience. And some of the, and they speak very articulately against some of the more populist measures that we see in the newspapers to simply restrict screen time or simply ban mobile phones at school, and instead to find, as indeed many researchers would say, to find more nuanced solutions. So I want to say as my last thing about, we did a consultation with the Five Rights Foundation, next slide please, as part of the Digital Futures Commission, in which we very directly asked children, this was just in Britain now, how they understood their rights in relation to the digital environment, what for them could be the positive, what could good look like, what would be positive for their development, as well as what would be a problem. And so I offer you, and I've brought a report here, a notion of child rights by design, to build on efforts for safety by design and privacy by design in relation to the digital environment, and really take on the full range of child rights by design. And the next slide gives you our 11 principles, which you could just click through, ping, 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 if you'd be so kind. So we tried to map out, to cover the range of child rights, and what designers and developers have told us they want is questions to ask themselves, not necessarily here is the answer, but they want to be provoked and required to make the effort to think about equity and diversity, to really work on what is in children's best interests, to know how to consult children and have the resources, to work out ways of making their resources age appropriate, to be responsible, to promote participation, to ensure privacy, to ensure safety, to promote well-being, development and agency. And those 11 principles really are what we found as a way that is kind of working with the design and product development community, but embeds the full range of children's rights. Well, Europe is working on a code of conduct on age-appropriate design, so I hope that will be, I'm sure it will be child rights, it will respect children's rights. And my last slide is really just to remind me to say there are a lot of challenges of implementation, and I hope we could discuss the nitty-gritty of some of those. How do we know who is a child online? Do we support age verification for everyone in order to identify? How can we protect children if that involves taking a lot of their data, so we perhaps protect them at the cost of their privacy? What really does their best interests look like in relation to digital products? How do we get businesses to bear their responsibilities as duty bearers? So perhaps my last sentence is to say what's needed really is political will to make the change and to implement children's rights online. Thank you.
Thank you very much, Sonia. As you said, the political will, and that involves all of us, not just politicians.
Absolutely.
That's the polis, the community as a whole is the polis. So we jump a generation.
Thank you for invitation. I'm happy to be here, and as you have seen, maybe I'm talking twice today. In my first part now, I will concentrate on Act Together Germany, and what we did in Act Together Germany is it's connecting to many things already said. So I hope you will enjoy. And in the second part, I will focus on what we do by our work in KRF. So just that you know how I will go on. So next slide, please. First of all, about me. My name is Uven Ergün. I'm the chairman of the management board and founder of KRF. I'm also head of Act Together Germany, which is implemented in Germany by KRF, so by my organization. And I'm looking on the topic of today's talk from different perspectives, as you can see. So I'm also chairman and member of the executive board of the National Coalition Germany. So different countries have national coalitions, which networks for the implementation of the UN Convention on the Rights of the Child. So in everything I say, I have always different perspectives with me and different heads. Next slide, please. Just a small introduction about KRF. KRF stands for Kinderrechte Forum, which you can translate with Kids Rights Forum. It's a non-profit organization with headquarters in Cologne and was founded in 2013. Individual help, advocacy work, encouraging engagement are our main corners of our work. The focus of our work is on our independent ombudsman office for the implementation of the UN Convention on the Rights of the Child. Long sentence, I know. So we help children and youth people to get to their rights. So that's very simple what we do. In our independent ombudsman office, we have psychologists, lawyers, social workers, which work interdisciplinary, so to save children's rights. In addition, we do also projects and have different corporations, like with the Learning for Wellbeing Foundation in Act Together. And our priority topics are democracy, society, digitalization, and sustainability, always in the context of children's rights. Next slide, please. I don't know if everyone knows Act Together and what we do, so I will explain a bit what Act Together does in general. Act Together gather, strengthen, and give visibility to children and adults that work in competent partnerships to realize children's rights and well-being. We work locally and internationally. Act Together involves 3 strands of activities. So we have Together Link, Learn, and Land. In Link, we're forming alliances between child-serving organizations and with children to catalyze social change. Together Learn is to cultivating capacities and creating resources that help children and adults be better partners in social change. And Together Land gives a transformative gathering for all ages to play with the serious challenges of their communities and the world. So that's what we do. Next slide, please. Yeah, it's fine. Between 2019 to October 2022, Act Together in Germany was implemented by the Bertelsmann Foundation. I think you all know Bertelsmann Foundation. Their goal was exploring children's role in promoting social equity through intergenerational partnership. And Bertelsmann Foundation co-created the concept and image of Act Together and organized the very first Together Land. So that's what they did. We even were part of this partner network and worked together with Bertelsmann in this first period. And now they handed over the project to us. So since October 2022, it's led by KRF. And we are now focusing on creating local spaces of dialogue addressing young people's mental health. So that's what we do. Next slide, please. Coming now to the Together Land Camp Cologne, it took place on 2nd June this year. We had 40 participants, among them 33 students aged between 12 and 17 years old. 36 male and 64 female people. And the program was, of course, a short presentation of Act Together. We had an input on mental health and self-efficacy, learned about the different areas of mental health, that they, as young people, have a right to mental health. So also connecting mental health and mental health issues with children's rights, and also seeing mental health issues as child rights violence, and they can and how they can influence their mental health. Following this, we had different workshops which were designed to give the participants suggestions on what they can do themselves to improve their mental health. Next slide, please. We had different workshops, like we had a parkour on discover one's own strengths and resources, a self-assertion and self-defense training, an elective offer on the topic of movement and relaxation. And after and before the camp, we did a little survey to see which effect our camp maybe has on the children and youth, and also to see what they know, what they want, to get to know what they want from us as adults. And that's what I want to share with you in a very quick resume, because it was a very big document we got out of it, and many information. What was very interesting for us, but also already told by Professor Joanna Inchley, I think, that some children and youth do not feel comfortable, especially in school. So that was an interesting information. And the reasons for not feeling comfortable are very different. Sometimes children told us discrimination is a big topic for them. School is no fun was also a point. So they would love to have more fun in school. Or dissatisfaction with the teachers is also a big point, which influences comfortability of schools. School and stress, as well as the use of free time, have a big impact on mental health. So in the own view of the children and youth, so that's what they answered itself. An open dialogue in the family, but also in school, could be helpful. So that's also a point children often missed, so that they can't talk very open in the family, but also in school about mental health issues. Places are needed where an open and intergenerational exchange can take place was something children and youth told us they need and they want. And many children and youth want to be active in some schools. They have even set up their own working groups to improve mental health. And what was very interesting is that after the children and youth shared this idea of a working group in schools with other children, we had other schools and children who also set up a working group to improve mental health in their school environment, which was very, very interesting and a very positive effect of our Togetherland camp. And now we have also different exchange spaces with these different working groups, to improve mental health. That's a very quick overview of Act Together Germany and what we got out. Thank you for your attention.
Thank you very much. So now we can, for a short time, have some questions and answers to our three speakers before we move on to the other young colleagues we have here. So has anybody got any questions they'd like to address at this moment? We'll have a bit more opportunity later in the afternoon. Joanna.
It's not a question. I really want to thank you, all of you, for this amazing work. This is not a question. It's that I come from my mother's mother. And I see parents around, but I think one key issue, if we want to think a little bit broader to support their families and to support the others for
Excuse me, sorry to jump into, but please open the microphone because otherwise people online cannot listen us. Okay, yes, but okay, for the next time. Thank you.
Just to say that I agree entirely with your point. Mother's mental health, parent mental health passes on to children, transmits so quickly. We say in the paper it should start from day one for children, and it's getting the environments right. Mother's mental health is driven by all sorts of things. We can't forget poverty. We can't forget changing in housing conditions. We can't forget violence in the home, domestic violence. And we know that the healthy families are such great protector of mental health of children that it's a prerequisite. Thank you.
Well, also very interesting presentations. Thank you. I think that the next issue, or the last issue about family health, not just mothers, but I think the whole family and being healthy in a marriage instead of fighting together, all these issues might cause a lot of problems for children's mental health. But we know the figures, we know how many children are in trouble, we know the quantity, but are there more causes we can detect? Mental health of family, I think it's the main maybe, social media, etc. But do we have data on what are the causes of the problems that the young people face? Are there more other things we can do about. I'm just wondering what is happening in the world with our youngsters.
Well, that's a huge question. I think that's the question we're all trying to grapple with. I mean, I think we've, Dominic mentioned earlier some of the sort of more global changes that we're seeing, climate change, financial crisis, political instability. So these are the contexts in which young people are growing up, and these are having a massive impact on how young people feel about their lives now, but also particularly about their future. And, the sort of anxiety around not only climate anxiety, but around sort of future, what their future is going to look like is huge. How we address that is another challenge, and we need to bring, I think, families essential, but it's about how do we connect these different environments. From a child's point of view, they're not siloed, they're all part of their lives. So bringing it back to a sort of child-centered perspective, how do we bring together families with schools, with the online world, so that from a child's point of view, it's all connected, and they're living and growing and learning in environments that nurture and support them. We know that families have a critical role in buffering some of the sort of negative impact that external pressures can have on young people, for example, school. Vice versa, schools can buffer some of the negative impacts that difficult early life experiences have on young people too. So we really need to bring everyone together to address some of these big challenges. And so for young people, sometimes it's the day-to-day difficulties they have around relationships, whether that's at home or at school. It's the pressure they face at school, but it's also the big kind of the world in which we live in, which can be quite scary, I think, as you're going through the adolescent years and wondering what that's going to mean for you when you enter adulthood.
Thank you.
Hello, so my name is Louise. I work for SOS Children's Villages. So we are a federation present in 130 countries, and we support children and young people who have lost parental care or at risk of losing parental care. And I just wanted to get back to a point about trauma-informed services. Something that comes up a lot in our discussion with our colleagues is around social workforce and more broadly schools, police, justice system, where on one hand, they're not well supported enough in their own mental health to support the children we work with and for, but also just the training and the working conditions. So just to make sure that they are trained enough to recognize, identify, for example, in our case, trauma, because the children who have been separated suffer from trauma, have been separated from the parents, but also respond to this trauma. And I'm just wondering if you had any reflections around, because I think it's where the EU could have a lot of impact, promoting, encouraging member states in training all the different workforces, but more around also raising awareness, stigma. So also in the professional sector that work with and for the children. So just wondering if you had any reflections around that. Thanks. And thank you very much for all the presentations.
So we mentioned it in our position. We believe that this is how services should be prepared for children. They should be trauma-informed. Every actor, I think Sonia put it quite succinctly, the people around the child, from the clinicians to the educators, to everybody needs to know what it takes to first recognize and then support children's flourishing in terms of mental health. And there's ways that there are a myriad of different ways to sort of begin to train. I mean, we're about to publish a study with UNESCO that I could tell you there's a dozen ways to go about training people who have direct interaction with children, and it depends on the type of children, in terms of their experiences and whatnot. But we're not going to have success in training any set of professionals unless we remove some of the burden that's already on them in the schools, remove some of the burden on the health professionals to be reporting and monitoring certain things which we might not think are priorities anymore, and provide them with the resources. Just to flag that every European country spends about half of the wealth that's generated by its citizens through public services. There's opportunities to do an amazing job here. But as long as we're keeping teachers busy with standardized testing, we're not going to give them the space to do the mental health work. And the same examples work with health professionals, or social workers and so on.
Thank you. Now we have to move on, but let me try.
Yes, well, thank you very much for being here. We heard a lot from our professionals in terms of how we see the situation, and we had a lot of data. And some of the data is quite scary, particularly in terms of the girls' situations, without wanting to discriminate, but that 66% at age 15 has hit me quite profoundly. And so I believe that, well, let me say first who I am. I'm the chairman and founder of the Learning for Wellbeing Foundation. We have a dream, a world where everyone can fulfill their unique potential. And we have a definition of well-being, which means realizing your unique potential through physical, emotional, mental, and spiritual development in relation to self, others, and the environment. So we are specifically trying to address what we call promotion of mental health. We don't deal with prevention, and we don't deal with the aspect of healing. But we have invited here people who have knowledge about it. And in our previous QoC, we talked a lot about trauma, and I heard we talking about trauma-informed environment, which are necessary for development. For me, the critical issue is how do we partner with children? You heard about from Owen about Act Together, which is trying to create partnership, intergenerational partnerships. And we have a panel here of four young people that would like to speak to you about their situation. And two of those people are more professional children, because he is 27 and has started working when he was 18. It was 18, right? Or 19?
19, 18, yeah.
18. So it has been a demonstration of a very significant commitment to help his colleagues, children. And we have Grace that has also been involved in the issue, she's 24, of climate change and mental health. And then we have Victoria Chantelot, who will talk about her own view and experience, together with Giorgio Guglielmotti from Rome. And so the key issue at the end, and I would like very much to ask you to think about, how do we actually partner with them? Because they are the ones who are suffering right now, but they also probably have a lot of the solution and the ideas, and we need to find a way to have them participate with us. So I'd like to first ask Grace to say a few words about where she's coming from, what her experience has been. Grace, please, 2-3 minutes about it.
Yeah.
And then we'll have more of a other people presentation, and then we'll have a discussion. Okay.
Thank you so much for having me here. So I'm Grace. I work for the Resilience Project, and we resource young people to cope with the emotional and psychological burden of the climate crisis. So the climate crisis is something that has been mentioned already on this panel, and I think it's really important to think about the wider perspective that young people are growing up in now. So the definition really of climate anxiety is emotional, mental, and somatic distress in relation to dangerous changes in the climate systems. So I think the word climate anxiety is a bit reductive, because really we're talking about all the climate emotions that young people are experiencing. So that's fear. Young people are really scared about what their future looks like, which has come up as well. You know, it's anger at the institutions that are continuing with business as usual and not listening to them. It's powerlessness because they feel like there's nothing they can do about this situation. In lots of cases, it's apathy because they're already resigned to a fate that has been inflicted upon them. So just for a bit of context, Caroline Hickman, who is the leading expert on climate anxiety in young people, found that 84% of 16 to 25-year-olds are currently experiencing climate anxiety globally. So that means we have a whole generation of people who are growing up feeling unsafe. When we just let that sink in and think about why they're experiencing mental health problems, these people are scared for their futures. They're not excited. They don't have hope about what they can be when they grow up because they're scared about whether they're going to be able to eat, whether there's going to be any food. They're scared of extreme weather events. So the psychological toll is enormous. These young people have been told that they are the last generation to be able to save the planet, save people. That's a burden that has been placed on this generation. They did not cause the climate crisis, but they've inherited the burden to fix it. And then for those who are stepping up to actually try and do something about it, they're being criminalized by governments. They're being attacked by the media. They face public hatred, online trolling. So for those who are actually trying to do something about it, the mental health tolls are even bigger. I think we can go into it more in a moment, but that's kind of my introduction, just to keep in mind the wider scope of this situation that young people are growing up in.
Thank you, Grace, very much indeed. I would like to just point out that this is really also a problem of how we deal with climate, because we scare people into what we think they can act, but by scaring them, you are actually also paralyzing them. And when I participated in large climate action situation, there was no talk about the importance of working in education, but just in immediate action, whereas we still have time if we want to, but to create a foundation, we need to work in the educational sector from this respect. I'd like to give the word now to Giorgio. And my father's name was Giorgio. So.
Thank you. So yes, I'm Giorgio Guglielmetti. I come from Institut Saint-André here at Brussels. And yes, especially after COVID, I've started to see a pattern that was repeating itself. A lot of young people were dealing with mental health problem. And so I think it was a little bit, it's our duty as students to speak up and to tell the facts and what we're experiencing. Thank you very much.
Okay. Okay. Victoria.
So hello, my name is Victoria. I'm 17. I'm at Institut de l'Assomption in Brussels. And so I'm here to talk about my point of view of what's going on. In my opinion, people are becoming more and more aware of mental health problems among young people. But one of the fundamental problems is that when a child speaks, there's no follow-up. Because we are always told that if we're not well or if we have a problem, we must talk about it. But for example, at school, if you have the strength to speak about it once to the school psychologist, who is in Brussels called the PMS, after 2 consultations, they will tell you that you must find someone outside the establishment. The problem is that they don't do the search with us, and therefore, often children would dare to talk about it once, won't talk about it again. So this is what I mean when I said that there is no follow-up when a child speaks. This is not good because it creates a vicious cycle. So for me now, we need to find a more systemic follow-up.
I think you can continue. because you have more to say. And then I will ask Giorgio to continue as well. Please.
So another thing is that in my group of friends, there are several who have a mental health problem, but it is not all for the same reason. So the problem is that no one takes responsibility for these various sources of various problems. Because if someone is bullied, is it the school the place where the child spends half of his time that should take responsibility? Or is it their parents where the child spends the other half of his time that should take responsibility? But to help the child, we need everyone. But the problem is that school expect the parents to do it and vice versa. It's even more complicated when it's online because as social networks don't belong to anybody, ultimately no one is held responsible for helping the child. I can give you a personal example. I had a problem with online bullying when I was 10 years old. When these children that were 3 years older than me were threatening me to come and hit me after school, I decided to talk about it to the principal of my school, who told me that as they were not the students in my school, she couldn't do anything. My parents, since it was online, didn't know how to help me either. So because no one knew how to react, I was left alone. Thank you.
Thank you, Victoria. And for me, it's important that we hear from the real voice so that we understand this is a real issue. And we cannot let it slide through too many studies if we don't start acting together. Giorgio, do you want to say a bit more?
Yes. So thank you very much for the opportunity. Oh, okay. Yes, thank you very much for the opportunity given to us to speak. Beginning of September, I learned something that will actually change my perception of today's society. When I learned it, I was appalled because I definitely have heard about it before and I've known the statistics. I've seen the poster in my school always. I knew it was there, but I guess I never truly realized. What I learned is that a friend of mine tried to commit suicide. And so I asked myself, what can we do in order to save those lives? What can be the solution that will be accessible to all of us young people to prevent such tragic events to happen? What would I like to see in a society where the well-being of children and students is promoted? In my opinion, the right tools should be given to us to help ourselves or others. In the same way that we are taught in schools or even in some workplaces to deal with cardiac arrest, students should be taught how to manage their mental health or how to help someone in the middle of a mental health crisis. Especially in schools, because sadly, it is where students have more difficulties. One of our teachers used to tell us a metaphor in order to success our exams. She told us that exams were like a marathon, and the key was consistency. I believe that it is the same with mental health. If you sprint from the very beginning, you might get burned out or hurt yourself. But if you take it slow, sometimes intentionally, so you can recover a little and definitely be more successful. Seeing more and more of my friends and classmates in general, like myself, that are overworked, overwhelmed, and simply are falling behind, I won't find the possibility of having mental health day off such an odd or unproductive thing. I would rather find it progressive and caring, because sometimes it is okay to pace out a bit. And sometimes we tend to forget that maybe the productivity of schools isn't the biggest factor that we have to take in account. Thank you very much.
Thank you. We ask ourselves at times what to do, but it's clear that education of parents and education of teachers in mental health issues is a must today and in our situation. without which we will not create a shift of attitude or system. Owen, what would you like to say in relation to what you've heard and what has happened, and how have you been able to deal with it in Germany through care?
Yeah, thank you. First of all, very impressing, and I'm a bit speechless. Thanks for sharing. I can agree with what you explained. We have in our ombudsman office, or overall, we reached last year, 2022, 6.5 million people all over Germany. So that's a number which what we reached as people. And in this, we have 80% children and youth, so under 18. And we have more or less the most youth reaching out our service have a problem with the right on health or right on good living conditions. So these both categories, both rights makes out more than 50% of all other consultations by children and youth we had. And if we go deeper in what means a violation of the right on health, for example, we can see very well that the most children and youth have issues with suicide. It's 12%, followed up by depressions and general well-being, and also self-harming behavior and fears in general. So that's overall why I can totally agree with what you told. And one of the main problems children and youth have is that they don't know where to go with these issues. Mostly children and youth come to us if they have tried many different other ways. They go to the principals in schools, they went to the social workers or psychologists they have in school, they try to get help in families, but it never helped that well to solve the problem at the base. And that's what we try to do. So we try to help children in these cases to find a solution together for the problems, and to prevent them from other things like suicidity and so on. Yeah, very big problematic topic, and I don't know how to solve it in schools or in existing systems. So I think what we need is a place like like governments asked for by the UN Child Rights Committee since years and years and years. So that's what the UN Child Rights Committee wants since many years, 20 years or much longer, that children needs in every country an institution and place which is independent, where they can go and get child rights based help which is made for children and youth.
Yes, I think we need to simply reflect about the system in which our children are living. I remember Michael Mattes, who was the chair of the Alliance of Childhood, was always saying if you have a pond and the fish in the pond are getting sick, and you want to take them out, make them healthy, and put them back in the same pond, you have really done very little. So what needs to change is the pond in which the children are living. And so, as I said before, I think we need to really up our ante in terms of human development and in terms of the mental health expertise that our institutions need to hold themselves. It is one thing to say, okay, we will have a specialist in a school dealing with mental health, and or to say everyone needs to understand enough about mental health to be there to diagnose and support and be a first responder in that respect. So, and there are methodologies to help also prevent trauma to take place and prevent the situation to deteriorate if they are spotted at the right time. I think I would like to give the floor to any one of you who wants, because you have heard each other, and you may want to add something to your story.
Thank you. I think something that's really important to outline about climate anxiety is that in itself, it is not a mental health disorder. It's a normal and natural and healthy response to an emergency, but it becomes a mental health disorder when it's not dealt with properly. So Caroline Hickman, who I mentioned before, said that the only way to eradicate climate anxiety in young people is to increase it in adults in positions of power. So what young people all around the world need is for policymakers to care as much about the climate crisis as they do and to act accordingly. That currently is not happening. So in the meantime, organizations like the Resilience Project, who I work for, work to resource those young people so that they can bolster their resilience. And we need lots more of that as well, because the climate crisis is only going to get worse. I imagine that the fallout, for example, in Europe this summer is going to be pretty catastrophic after the extreme weather events that have completely ravaged this continent this summer. And so we really need to be financing and resourcing organizations that are working to build resilience in young people. But because climate anxiety is still, understanding of climate anxiety is really low, which means that organizations that are trying to work around it are just chronically underfunded and underappreciated as well. So there's lots that policymakers need to do, but there's also work that everyone can do as individuals. So adults can help young people with their climate anxiety. And I think the main thing that people should be doing is validating those emotions, because essentially young people are being told by their leaders, by the media, by adults that everything's okay, but they know that it's not. And that makes them feel like they're going crazy, because they're looking at the science and they're seeing that there's problems and that their future is looking really desperate. And yet when they stand up to try and do something about it, they're told that they are the problem. So adults can do lots of work in validating young people's feelings, listen to them talk about their climate emotions, tell them that you're scared as well, because just trying to fix and take away the pain is actually quite frustrating for a young person that knows that everything is not okay. So that's something that everyone can be doing to improve young people's mental health around this topic.
Owen, you wanted to say something?
Yeah, just one point as a reaction on what you are saying, Grace. It's all right. I agree totally with you, but I want to outline it's not just a problem you are describing in this climate field. It's a general problem we have as adults with children and youth. So we normally tell them what's right, what's not right, what's happening, what's going on. We must, or we can just solve it if we learn as civil society and governments to hear on the voices of the child and yeah, and try to help them really to get to their rights. So that's an overall general problem you are describing.
Yeah, I think we will conclude, but just to give you any information, my friend here, the German government has decided he stopped the funding of his organization, which the government was supporting quite extensively because they have other priorities. So it's a question of political will, and we need to find a way to provide sufficient partnership between adults and children so that they are being heard in relation to it and are convincing the political establishment that they need to take action. Thank you so much. I'll
Thank you,
pass
Daniel.
it on to you.
Questions and a discussion. I think you had a question that we cut off earlier. Is it still relevant?
It doesn't really follow from this discussion that we've just had. It was mainly for the previous people. I wonder if maybe if people got just questions about this panel, that might be better coming now. Okay, I'll try and reorientate the question then. My question is to do with priorities. I mean, what's been described here are that mental health, the trend data show that mental health issues are getting worse. And from Sonia's presentation that digital issues are evolving and they're changing at a speed that makes them quite difficult to address in a policy environment. Now, I work in the field of evidence-based policy making, and so it seems to me that the surveys which have been described here today show the importance of having solid evidence when it comes to evaluating what an appropriate policy response might be. Linking that back to what Dominic was saying right back at the beginning, when he identified 57.6 billion euros as the cost of mental health, then there's an enormous issue to do with the priorities when it comes to how we deal with this. And what we also need to know is what sort of interventions that are we making that are actually working. You know, so that we need to invest in data. Quite obviously, we need to know what's going on. We need to invest in interventions to try to improve things, and we need to invest in evaluations of those interventions to find out if they've actually gone well. So my question is to do with priorities, and the priorities that the politicians have, the policymakers have, and the funding bodies have. Because it seems to me that there's a whole lot of things out there that people want money spent on. Big science projects in physical sciences to do with climate change and so forth, but in the social sciences massively as well, because there's a direct effect that we can have on people's lives in trying to improve mental health and get that 66% that you identified, Daniel, down and make sure that the trends go in the opposite direction. So my question, I guess, is how do we, to everybody, how can we influence the broader political context to try to make sure that the resource goes to the data collectors, that it goes to the people who are implementing the policies and the people who are going to be evaluating those policies?
Anybody wish to take that up? Sonia.
Well, I think the researchers in the room all care terribly about this question and all have painful stories of failing to get the funding for research that we believe to be important. So I shall try not to rant. I think we do need to agree some ground rules for collecting data. So one thing I find very frustrating, I won't speak for Europe, I'll speak for the funny island I come from, where a lot of money is spent on research for policy making, but it's not spent on research that generates data that becomes open access or available. it's often commissioned to companies who are seen as rapid and efficient and make beautiful reports. I'm sure they do excellent work, but when I go even to very reputable organizations and say, you've been collecting this data, can you put it in a public repository? Can we use it for other purposes? It's gone. It's just, it was never available in the first place. And I can think of, so I think there is, there's an extraordinary amount of waste, even in the volume of research that is being collected that could be better used, that could be reused. And I think I might invite Joe, but I know as someone who's tried to work with repeated surveys over time, and Gary, this will really strike you too, that when we come to research agencies that also do put money into research, they're not interested in repeating what we did 5 or 10 years ago to see if things have changed. They want a new question and a new challenge now. So we always chase the new. But in this field, we need to understand change. We need to understand how, and that sometimes means we need to repeat questions in new contexts to understand the processes better.
Lea.
Hello, can you hear me? Yeah. So I'm Lea. I'm Chiara's intern for Learning for Wellbeing, but I'm also a student, and I'm 23 years old, so I can be in the youth part. I just wanted to react on what you say about validating emotions, children and young people emotions. I also think it's important to create environments and give the space for also children and youth to express or understand and learn about their emotions. And about that, I wanted to make a connection with what you said about the gap difference in mental health in gender. I mean, gender gap in the mental health. Because, for example, I think we see a big difference in how male boys or men will understand and express their emotions, and it leads to I don't know, violence or higher rates in alcoholism or suicide. So I think it's really important to also research this gap, and I wonder how, and maybe that can be a question if you want to react on that. I wonder how emotional intelligence has an impact, like has an influence on those results and this gap that you have been researching in. And yeah, I think to speak about a solution, I think also it's important that school can create those spaces, and also teachers or adults that surround children and youth. For example, I think in teacher training, or like we have so many tools in education, like for example, social emotional learning, and we know that we can learn about emotions and we can learn to understand and process them and express them. And it's so important, especially for men, for example, like to be able to talk about their emotions. And yeah, so that would be my input. Thank you.
Good afternoon, everyone. Thank you for this great panel. I'm Gabrielle, and I'm representing Quest, an NGO working on quality education. I wanted to build on what has been said. I completely agree with having the spaces for voicing youth concerns and also having all those social or a feeling of social protection for youth. But I feel another challenge that is being here is also being able to create education systems and promote education systems which are actually showing to youth that they can be a solution to their problems, have initiative, be there for themselves as well. And especially if you talk about eco-anxiety, show them how they can go into creating projects and be part of the solution as well. And I feel that today,
most of our education systems are not promoting this initiative taking and rather imposing an idea of youth as having to absorb content rather than create and reflect. And so I wanted to bring this challenge as well and ask the panelists' opinion on it. Thank you very much.
I think there's a lot of evidence, talking to both points here, there's a great deal of evidence about how educators could work and focus on children's social emotional well-being and development and involve them in issues that are important to them and address this square peg in a round hole. We're working with education systems which are like factories rather than places where children are given the opportunity to flourish. Again, I'm going to say that we need root and branch reform to make it happen, but the What Makes Me study, we published this study I'm talking about, UNESCO, which we published in November. There are hundreds of examples, high quality research examples about how practitioners could instead focus on facilitating the promotion of innate human skills and the basics that underline some of these things which we think education systems should be producing, but I debate you on it, like literacy and numeracy at 10 against all other ambitions, or qualifications for the labor market at 15. There's other things to be doing, like building resilience, understanding each other. The theory of mind, if you're in a room and you understand how everyone else thinks, that room is going to be much more effective than if you're in a room where everyone is treated the same. And it's through that diversity and through emotional development we achieve equality. So we have to sort of sweep off the table these old ideas of education systems and move into a new way of working. But we won't, no, not soon, because it's all tied to labor markets and timings and whatnot. Fundamentally, we're doing ourselves an injustice. But the evidence there, and I can share with you, but it's always, I don't want to say it's political will again, because it's not. But you get in a catch-22 when everything is so pressured that you don't have the time, either at the systemic level or the individual level, to take the step back and rework your processes. And as a community in Europe, we need to step back and rework our process. The evidence is there.
Very shortly, briefly, I am under pressure, political will, yes. Yes, but I would like to say that young people, Grace said that no follow-up when children talk. I am not sure that no one, because I know a lot of politicians here in the European Parliament, in my Czech Republic, who are listening to you. Where is problem? We know very well that joint climate and mental health is really important for you. And we try to do what we are possible. For example, I think under 4 years pressure to commission, we have comprehensive approach of mental health. I know it's not easy. We need to push more because we need concrete steps how to deal with mental health with young people. And we don't need only enlightened politicians, but we need also enlightened teachers and society. And we shouldn't not hesitate to talk about mental health and stigma. And we need more prevention in school, high school, elementary school, kinder school. It is really our goal for next mandate of European Parliament. And we try to push European Commission also for special year for mental health in Europe to take big pressure that it is really good step for our young generation, because my generation is maybe the latest generation which can do something with environment. And if we do not anything, then it's our fault and bad time for you. And therefore, we need to solve environment and go together with mental health, because you are our future. And I promise that we will do anything what is possible, not only about talking with experts, because that is concerning gender gap between young girl and young boys is really, for me, surprising. And we do everything what is possible, and we will continue with our pressure for European Commission and our government in our countries. But it takes some times, but you have a few politicians who are listening to you.
Daniel?
Yes, I heard Dominic talk about the need for creating a space for reflection, because there is already so much evidence that support the case for something different than what we are having now. And I believe it has a lot to do with what we define is the purpose of education and the role of parents as partners in that purpose of education. And so I would invite us to really think about how can we create a space where we are going to discuss what's the purpose of education. Today, the purpose of education is not the development of the child and its unique potential, because we're not looking at children in an individual way, we're looking at them in a standard way. So if that is the way we're looking at it, it will never work, because you need to understand that every child is unique and every child has his own way of learning and assimilating and developing and communicating. That creates the need to have individuals who understand that, are capable of listening, are capable of interacting. So how do we create a space where we are fundamentally thinking about what's the purpose of education, and then move the forces that can make decisions in that direction? That is,
We're coming to the end. I just wanted to bring up. Oops, sorry, my mistake. I was a teacher, I confess, for young people. And looking back, when I've been looked back over the last years where I haven't been a teacher, it was the greatest privilege in my life to work with these young people. One could feel a potential when one spoke to them, when one worked with them. I was lucky, I worked in a progressive school, not a state school, which we're dictated to, but it gave us the space to respect the young people, to respect the children, and to listen to them. And those voices of my teaching still come back to me now. It was an amazing experience. I really grieved when I was no longer a teacher. A grieving process, having missing that quality of relationship with the young people and the children in the school. But I was given other responsibilities. And as Madam Maxova has said, that political will, but as you said, the political will, but that is us. It's not just the politicians. So the Greek word polis is the community as a whole. And if you want to do something about it, it has to be the polis as such. This is such a complex question in so many regards. And using the data and finding the data is one step, but it goes far beyond that in actually inspiring, empowering, and communicating that in words that people feel sympathetic to, can understand and follow. When we have these meetings, as I said, 90 of them, I mentioned before this metaphor of building a cathedral, but that's always a vision. That's always a vision, because every time we meet, we start digging the foundations again. This world is so fragmented. There's so much change. We have to constantly recycle the foundations of what we're building. But I think that's an important lesson, because it also helps us develop our own humility, to be able to listen, not to feel we have the answers, to have a moral listening capacity, to listen to each other. There's a lovely poem by Yevtushenko. He was a dissident poet in communist Russia. And there was this terrible school massacre in Beslan, where more than 200 children were killed, shot in the school. And he has one line in this poem, which always has stayed with me and stays with the Alliance, really. That sacred word, together. Yeah? That sacred word, together. And I think this is what we've got to do with civil society, with the political society, with the economic society, is that sense of togetherness. And that's what I think we can learn from the children and young people, how important togetherness is in all its different emotional categories. And I hope this sort of meeting can somehow build new foundations for that, not only in our society, but also within ourselves, because our society is a reflection of ourselves. It goes together. The inner world that we live in and the outer world we create are meshed in one form or another. So it behoves us, it's inherent for us to actually act. And in our small way, act together. The other organizations we've heard from, the Alliance and others, are trying that, to build that act together, that togetherness between us, because only then, as Sue Palmer pointed out, as I said, can we make a difference. So thank you very much for coming. This will be on YouTube, so you can listen to it again. There was a lot of information to follow through. Just to say, this is our new brochure, and this is the third edition in about 8 years. So that's the way the world changes. So it's new diagrams, new concepts in there, but we have to move, always moving with the times. Madam Maxova, would you like to say a few words to finish with?
Thank you. Thank you very much for organizing this event, for my invitation, for knowledge of our experts, numbers, and research. And now I am thinking about next event concerning gender gap and mental health and boys and girls, and my assistant will be happy to organize the other event, because it's really important to talk about and send message government and MEPs here and other MEPs after election that this is really topic for next mandate, because this mandate I am feeling that it was environment, Green Deal, and beside it was social and maybe health. But now we should maybe get the same level or turn. Yes, thank you very much.
Thank you. This will be our work in the future. We're going to work on mental health December the 6th on early years, and then through the next year as well, with all our quality of childhood talks will be based on this particular document. So I hope you find it enlightening. And Chiara, to finish with.
Yes, thank you. Thank you to all. Just to say that this statement will be available on the website to download. Inside the brochure, you have seen also the invitation for the post-walk, how to reach the place. It will be hosted in the Learning for Wellbeing office. So after, if you want to have an informal talk with the speakers and the others and among us, please join us. And you can follow me and Melea then. I want to thank you all the speakers, the young panelists, and I hope that also, and I want to thank you participants, and I hope that everybody can take some inspiring insights from this session. Thank you to all.
And of course, now it's the moment of the picture. So please.